Welcome back. We now draw our focus to the recently concluded 37th Commonwealth Health Ministers Meeting in Geneva, led by the Minister of Health, Dr. Esperance Luvindao. The Minister highlighted urgent challenges such as rising diseases, mental health and climate impacts amid declining funding. Joining us via Zoom to expand on what happened or transpired rather is Deputy Executive Director of Ministry of Health and Social Services, Dr. Theo-Ben Kandetu. Dr. Kandetu, good evening and thank you so much for joining us.
Good evening, Nia. Thanks for having me.
Well, Minister Luvindao at the 37th Commonwealth Health Ministers Meeting highlighted the dual challenge of rising non-communicable diseases and climate-related health impacts. To start with, talk to us about how Namibia can realistically address these issues given the decline, in donor funding.
Many thanks for that question. Indeed, this has been quite a concern, and the minister, keeps on saying that Namibia, like many other African countries, is plagued with the double burden of disease, which is communicable diseases as well as non-communicable diseases. And so for Namibia, we've employed a multi-pronged approach. And so firstly, what we are doing is we are prioritizing preventative healthcare through public awareness campaigns and promoting healthy lifestyles and early screening programs. As the old adage goes, prevention is better than cure. And so we've seen some of the most successful health systems the world over have prioritized very heavily on prevention and promotive healthcare, and these yield really great returns, in terms of health outcomes. And so this is one of the approaches we've adopted. The second approach is that we are strengthening primary healthcare systems to improve access to essential health services at the community level. And this we've done really by empowering, and equipping our community health workers. And so the role of community health workers was amplified at the Commonwealth meeting, as well as the World Health Assembly, which we also attended in Geneva. So it's important really to invest in community health workers, because unlike other health workers who are stationed more at the health facilities, community health workers are the ones who actually go out into the communities, sometimes even door to door, to deliver these health services. And so we've seen really that this is a cadre that is a cornerstone for achieving universal health coverage. And then the third approach that we've embarked upon is that we're exploring innovative financing mechanisms, including public-private partnerships, also increasing mobilization of domestic resources, really just to supplement the donor funding. Namibia has launched what we call a social contracting for health services policy. This was launched sometime in 2023, and so what we are doing now is we are starting to implement this policy, which really gives a framework. It provides a framework for government to cooperate with civil society organizations, to assist the ministry to sustainably deliver health services at the community level. So, we've been saying that the most effective health responses are those that are driven by communities. And so this is quite an important initiative that we have embarked on. And then just the last one is that we are also integrating climate resilience um, into our health planning, prioritizing early warning surveillance systems, really with respect to climate-related health risks, and then also strengthening our health infrastructure to withstand climate shocks.
Thank you so much, Dr. Kandetu. I also just want to touch on the WHO pandemic agreement for a bit, which is being hailed as a historic step. But what was Namibia's key contribution to this negotiation and adoption of this agreement?
Yes, indeed, Nina. So this was actually the highlight, or one of the key highlights of this year's World Health Assembly. Was the adoption of the pandemic agreement. So you are correct; it is quite a historic step, and Namibia was honored to play a significant role as the chair of the committee that ended up adopting this pandemic agreement. And so maybe if I can give you a bit of context, the negotiations on this agreement actually started in 2022 through the what we call the Intergovernmental Negotiating Body, which was established in 2021, in December 2021, by a special session of the World Health Assembly. And so Namibia has actively participated in these negotiations since the very beginning, advocating for strong and equitable framework for pandemic prevention, pandemic preparedness, and pandemic response. And so this is really also just premised, against the backdrop of developing countries specifically, and our experiences responding to public health emergencies of international concern, and the gross inequities that we encountered, especially during the COVID-19 pandemic, where we did not enjoy the same access to vaccines, the same access to therapeutics and diagnostics. And so negotiating this type of international instrument, this pandemic agreement, which really focuses on achieving equity, throughout all the provisions of the agreement, is a very key way in which we are able to right the wrongs of yesteryear, as it were. And so the culmination of all these efforts was the submission of the final draft of the pandemic agreement to the World Health Assembly for consideration and then adoption. And so, as Namibia was the chair of Committee A, the chair was the Honorable Minister of Health and Social Services, Dr. Esperance Luvindao. Namibia's role really as chair was to guide the committee's deliberations, on the agenda item to adopt the agreement. So our key, contribution was to ensure a transparent and inclusive process, and facilitating or trying to facilitate consensus amongst member states with diverse perspectives. So, as you have indicated, the outcome was that the World Health Assembly under the leadership of Dr. Luvindao as chair of Committee A, successfully adopted the pandemic agreement, which paves the way really for a more coordinated and equitable global response to future pandemic emergencies and pandemics.
Just finally, Doctor, what message would you like to send to Namibians, in the broader Commonwealth about the importance of investing in health now to safeguard future generations?
Yeah, so my message, I think, to all Namibians and the broader Commonwealth, I think would be, investing in health is not a mere expenditure, right? It's investing in your future. It's investing in the futures of your children and generations to come. As we say, health is wealth. A nation cannot truly be economically productive or socially productive if it is not healthy. And so health really is that foundation upon which all other sectors of the economy rely. So Namibia's youthful population also presents quite a vital opportunity for sustainable development. But to realize this potential, we have to work together, right? We have to work hand in hand. And so, what I would encourage Namibians, everyone who is watching or listening in, is really to take more ownership, more autonomy over your own health by becoming more health literate, by making informed choices, relying, of course, relying on credible and reputable sources for health information, and by engaging in healthy lifestyles and healthy habits. And so I think when we as individuals understand our health needs and the importance of maintaining health and well-being, we will then be able to economically prosper.
Dr. Theo-Ben Kandetu, it was lovely having you with us this evening. Thank you so much for your time and joining us here on the Daily Roundup.
Thank you so much for having me, Nina. Thanks.
We're going to take a brief break right now. We'll be right back after that.